Hey everybody, it's Joanna here from GSN Planet, along with my friends in the spa industry and representatives of our community. So welcome, we're glad to have you today in this sort of challenging and difficult time that we are all experiencing together. And I'd love to introduce them each and have them talk a little bit what's happening for them in their part of the country and in the businesses that they represent. And also welcome to Megan, who everyone knows from GSN Planet, who's sort of administering our conversation today. Our overall plan, just so you know, is that we received an excellent list of questions from many of you, and we expect about 150 of you on this call today. And so we'll be addressing your questions, and then after the webinar, what we plan to do is to send out an email blast to everyone with sort of the highlights and some of the things we've learned from the group. So that's where we're headed. If you have any questions during this, you can chat with us, right? We have a little chat button and you can chat with us and ask and submit any follow-ups that way. And again, welcome and thanks for coming together this afternoon in community to support each other. All right, Thor, welcome. So this is Thor Holm. He is out there at Osmosis Day Spa in Northern California. And then we have Leya Nicolait, who's in Vail, Colorado at the Sebastian. And we have Jessica Swartley, who is up in Stowe, Vermont. So welcome everybody and thanks so much for being here today.
Thank you.
Joanne. Thank you.
All right, so Thor, let's start with you. Why don't you talk a little bit about what's happening in California?
I lost you there for a second, Joanna, but today was the first day that Osmosis was closed. Yesterday, we received notification from the California Board of Massage that they were advising practitioners to suspend services based on recommendations from the governor's office. And then 7 counties south of us are in a shelter-in-place order. So virtually, our business needed to close. In our county, we didn't have a lot of confirmed cases, but as time went on, the feeling around being open seemed less and less comfortable for both staff and guests. So we made the decision to close Osmosis for the foreseeable future, hoping to reopen in May. And then just made sure we took care of our staff. We have a skeleton crew here still alerting our guests and then working with our partners to make sure that we've solidified the communication to them as well.
Great. Leya, let's move on to you. Why don't you talk a little bit about your property, where you are in the process?
Certainly. We're here in Vail, Colorado, which many of you may be familiar with, but if not, we are a luxury resort destination in the Colorado mountains. We have an international clientele, people who come from all over. We sadly we're one of the first to report a COVID-19 case here in Eagle County. And because we are such a tight-knit community here, our hospitality industry, we have people working at every hotel. And if they're not working together, they're oftentimes roommating together. So it was imperative, because of the contagiousness of this, that we take some very proactive action. And I can just say, I am so impressed with the medical leadership here from the Vail Hospital, as well as all of Eagle County. The leadership team in this hotel has been amazing. I feel like, we've been just one step ahead of some of the recommendations that have come out. against contact. We were reaching out to our employees before there were any recommendations, making sure they felt comfortable coming in. Of course, before we decided to then shut off all or suspend all spa services and then ultimately close the spa and gym. And we did that before there was a mandate by the Colorado governor, which just came out yesterday. So for right now in Colorado, there is a 30-day ban on all gyms. They haven't really spoken to spas yet, but I think ethically, just giving, again, the contagious nature of this, I think it's the right thing to do, even with employees in mind, about their financial security. I think the right thing to do at this point is to shut down and just try to stop the spread and slow the curve, as they say.
Okay, great. Thanks, Leya. Jessica, can you share?
Absolutely. You know, I'm here in Stowe, Vermont, ski mountain town in beautiful Vermont. And we closed our doors on Sunday afternoon, evening time, as well as the hotel. Our hotel shut down as well. We chose to make that call just because, you know, it's spring break here, and we really wanted to make sure that folks were staying home and not trying to flee their cities and come to us, just because we in Vermont only have so many resources, and we wanted to make sure that everybody is just kind of staying put and being safe.
I'm unmuted. Okay, let's start with some questions. So how are you guys handling your staff? Let's start with the tough question first, I guess. How are you communicate? What's the communication like? How are you providing for them? What resources do they have? And what are the plans that you've sort of laid out to communicate with them? Thor, we'll start with you, and then we'll just move through the group.
So we have a employee newsletter. So for the past 2 issues of that, we've been discussing you know, the potential of this and our steps to make sure that we kept everyone safe and mitigate whatever risk was there, which was minimal and still is minimal in our county, but still uncertain. So as of yesterday, Michael Stusser is our owner. He and I put out a communication to our employees and then also to our guests that we would be closing as of today. And then we provided them information on the state of California has opened up unemployment resources, waiving a normal 1-week waiting period, and also covering, even if it's not full unemployment, if it's just you're temporarily, and made sure that they had all those resources available. Let them know about paid sick time and that availability, because this is preventative in nature. It didn't qualify. So we made sure they had that information. We'll stay in touch with them too. Hopefully, as things proceed, you know, I'll keep doing my newsletter, let them know what's going on here. But we get consistent exchanges and information between human resources, myself, and our owner, Michael.
Leya, how are you handling it?
I started communicating some time ago with my team, and you know, I think one of the challenges that we've all had is this has been progressing so fast, and the information changes from minute to minute, hour to hour. And so an email that I would have sent out yesterday, you know, I wake up in the morning and that information, you know, from new information, then we need to pivot from that. So I think the most important thing has just been communicating with my team, you know, as we pivot. I think everyone, at least on my team, feels like we're doing what we can to support them and communicate to them. And it is a difficult time. And, we are also at the height of our spring break, and we do recognize that, unfortunately, this is the time when a lot of my therapists sock a lot of money away, for that downtime we have in May, because we are so seasonal here as a ski resort community. And it's challenging. It was a really tough decision for us to first, limit hours, limit services, and then finally make this decision to suspend services. It has been a tough decision, and it's been one that the leadership team here at the Sebastian and Timbers, we've all been working very closely to try to figure out what the best thing to do is for these employees, because as many of them, many of your employees may be on a low hourly wage or a no hourly wage, and commission or tip based. And depending on your state and where you are, that can vary of what they count as far as earnings go. So we wanted to consider all of the options. Right now, our HR is working diligently at the corporate level to decide what the best path is, and that communication will go out today for them on our final decision here. But it has been, ethically, we've been weighing a lot, and the employees have first and foremost been our primary focus and consideration through all of this. Our team here is very small. We're tight-knit, we're a family, and so we want to take really good care of them, but we want to ensure their health and safety. And it was a difficult decision to close, but I think what we'll see here is that the governor will probably mandate maybe even hospitality to close as well, like hotels. They just did that over in Summit County, which is the next county over. So I can't imagine we are far behind them, but I'm not speaking for the governor at all. But if trends seem to be going, that could be in our future very soon. And with that, there is going to be a lot of federal and state funding available. They have declared states of emergency at all levels. Even in the town of Vail, they just declared a state of emergency. So there will be funding, there is going to be support, and we are looking just local ways of how we can support. I mean, even if it's something down to toilet paper, not to bring that up because I know it's just so crazy that people are hoarding this, but just finding out, like, do my employees have toilet paper? Just on the most basic level. So, just doing what we can. I think in times like these, what we need to do is pull together as a community. I think on the federal level, that will be what it is, but where we are going to be strong is at the community level, and that just starts within our operation. And everyone here is like family to us, so we're just looking out for our family here.
Jess, would you like to tackle that question? What's the status of your staff and how you're handling them?
Sure, absolutely. We're doing a lot of the same things that Leya and Thor are doing. Some additional things that we have set in place. I'm feeling really blessed that working for Hyatt and our ownership, they certainly have been taking care of us. They're covering pay for us for the first 2 weeks that we're closed, which is an amazing feat from a company, from an owner standpoint. We also, because we're with Hyatt, Hyatt Connect is our kind of employee portal, and there's lots of information on there. And it is, updated, I would say every hour, every minute, as things change, because we all know that, this event has been very fluid and has been changing quite a bit. The number one thing I try and do with my staff is to be very transparent and to be open and honest with them. We've set up phone trees. So as new information comes out and we send out an email, we also then get on the phone and everyone calls everyone on their phone tree plan, just to make sure that they really understand that information and that's not information there to scare them. Because we all know during times like this, when people start to panic, they're only reading certain things. They're not reading the whole big picture that might be out in the email. And as well as I do, emails and texts can be misstrued and read differently to certain people. So it's important, I think, that we get on the phone with them and really have that conversation. Some other things too that we're doing, we were gearing up for a really busy week. As of Saturday, we were sold out for the whole week, and we had to call all of our guests and tell them that we needed to close. And so that was a really hard decision for us to make. But we have all this food and all these supplies. And so as we reach out to our staff and our teams, we've been saying, what do you need? Of course, the toilet paper thing, but, we have all this food. Can we bring you food? We'll drop it off on your doorstep, and when we leave, you can come out and pick it up. What else do you need? Do you need something for your children? Do you need something for your pets? Your pets are just as important. They're our fur babies, right? So we need to take care of them as well. So we've been really kind of just trying to make sure we're having these connections. We've been trying to call our staff, even if we're not sending out a communication on the daily, just to check in with them. I'd rather bother them and know that they're safe and healthy and all right than not hear from them for days and get concerned. So especially with, historically over the last few years, we've all been talking about, finding good help, good therapists, good nail techs, good SDs as the schools were closing. We need to make sure we're maintaining that staff level and keeping them so that when this is all done, they're going to want to come back and work for us. So that's been really important and something at the forefront of our ownership and our leaders. And, it's something that I've definitely been, making sure that I'm implementing into my daily task here to make sure that everybody's safe and all right.
Okay, great. So question coming in actually from Mexico, Mexico as a nation has 87 cases, and Deluxe Spa and Hotel in Mexico are receiving guests obviously from all over the world, and the nation is not closing business.
Joanna, we lost your audio.
Sorry, did you finish that or no?
We lost your audio at the end there.
Okay, so I was going to say any one of you could jump in and answer that question.
We didn't hear the end of it.
Oh,
but
the end of the question was, did you have staff who was either wearing a mask, or were you taking temperatures of guests coming into the spa?
At Osmosis, we did not have any staff wearing masks. Although, I think we were getting to that point where they would want to. But the confirmed cases in the county while we were open was only 3, and they came off of cruise ships. So, but as they pointed out to us, they were serving guests from all over. So it was a matter of time that we'd be exposed to greater risk. Osmosis is a day spa, so we don't have guests checking in. We did last week implement, in our confirmations and in our calls with guests, stressing to them if they have any type of symptoms, not to come, that will waive any cancellation, that we want them safe and we want our staff safe. And our staff was instructed not to provide services for anyone that was symptomatic, and we weren't going to let anyone check in with that was symptomatic. So
we had the same policies, Thor. This is Jess in Vermont. We were doing the same thing right before we closed. We weren't taking temperatures, but we were certainly making sure that the safety of our staff and of the other guests, we had, them in our best interest. And so we were certainly doing the same thing, making confirmation calls 2 days out to make sure, like, if you're not feeling well, please stay home. We're happy to waive that cancellation fee. And at any time, with anything and during any circumstance, if the therapist isn't comfortable, they're to end the service.
We had the same policy here, just if at any time anyone was uncomfortable, to stop the service. And of course, the same prohibition on any guests that were sick or showing illness, even from entering the facilities. And that includes the use of sauna steam room. So all of that was in place for us as well. As far as wearing masks, I did state to my team, wearing a mask doesn't protect you from the virus. When you are massaging them. And so it was really important for them to understand that, you know, during this crisis, there may come a time when we need the masks and we need the gloves, you know, for more medical purposes, to protect. And again, just because of the concerns here, you know, that's why we decided to, you know, suspend all services, just because there wasn't a way for us legitimately to protect our team, because people can have the virus up to 11 days or 14 days even and be, you know, highly contagious and not show any symptoms. I mean, that's the problem with this particular virus.
Right. Right. So one of the other questions we've gotten is about vendors and reps. So since you guys are all spa operators, is there something that vendors or reps can do to support you?
Well, I think it starts with, that's a partnership relationship, because, you know, our inability to purchase is going to affect the people they employ. So empathizing to begin with, you know, certainly if there was flexibility on returning orders and things like that, that would be great for a spa. But it goes both ways, and just having open dialogue and conversations. We also have partners that do laundry and other services for us. So that was one of our priorities yesterday, was to contact them, you know, apologize. They were all really supportive and appreciative of our care for their future as well, because we depend upon them and they depend upon us.
Sure. Anyone else?
I agree with what Thor says. In an industry that is as small as ours is, we are really an ecosystem, and it's going to be hard on both sides. Honestly, it's going to be hard for our brands. It's going to be hard for those of us who are on a purchasing hold right now, you know, where we have direct instruction not to buy anything. I think, you know, and for good reason. It's not for without cause. But yeah, it's just, you know, my heart goes out to some of these smaller brands, you know, having been on work for me personally, having worked on both sides. You know, I hope we all make it through together, and just know, you know, if there's anything that I can do to support you, please don't ever hesitate to reach out. You know, I think, you know, if you had auto emails kind of queued up for specials and different things, maybe consider revising those, because as operators right now in damage control, you know, just fielding through an inbox of sales auto emails, it can just be just one less thing we want to look at right now, just as an FYI, a thought.
Mm-hmm. Jess, do you want to answer that?
Yeah, if you wouldn't mind, I just kind of want to chirp in. You know, I think now too is the time, like while everybody's home and they're not doing anything, it's a great time too to be sharing like anything video, you know, video instructions or education with the teams, video information on maybe new stuff coming out, you know, not calling, but maybe sending the email to, you know, whoever your contact is at a property level. And, you know, having them share that with their team, it's kind of keeping everybody busy and it keeps their mind off of what's going on. I think that's really important.
That is a great point you just brought up, and kudos to that for education right now and building community. This is a great time for that. So great point, Jessica.
Great. All right, question about what do you recommend spas do during downtime to get ready and reassure guests that your place will be safe? Which goes right hand in hand with the very next question, which is what types of disinfection procedures and cleaning products are you using?
We're using the same cleaning products we always have. They're green and safe for the environment, but very effective. You know, I can't imagine any of us was not doing our utmost to keep our facilities clean. But What we did do while we were open was triple our efforts on touch places within the spa, lockers, door handles, any hard surfaces that could be touched by the guests and staff, and just repeatedly clean those throughout the day. I'm not certain, that first part of the question, what was that, Joanna?
What are you doing to prepare when guests come back?
Okay. That's a really good question. This is a unique opportunity that you know, if you had to ask me, you know, what's a good time for you to not receive revenue for a couple of months, it would be never, you know, but that's really in front of us. So there are things that we will want to accomplish to ensure that when Osmosis reopens for our guests and our staff, it's the best it can be. So that's a lot of what we're strategizing on now.
Absolutely. I think those are all great points as well. I would say to Thor's point, exactly, you know, using the same products we always have used. You know, we employ green products as well as, you know, barbicide, marvicide, and have definitely stepped up, you know, your religious sanitizing of all door handles and anything where guests are coming into contact. And that's out throughout the entire hotel. In the hotel, we've stepped up our common area attendance. So we're actually employing more people than we ever have before, just in common area. Not to say that we weren't clean. Of course, we were adhering to 4- and 5-star standards. So this was a clean hotel before, but you know, now it is a disinfected hotel, more along the lines of hospital clean, I think, at this point. You know, what we're doing to prepare for guests, being a seasonal resort, we typically have an off season, you know, where we do a lot of repair and maintenance. So taking this time to, you know, as soon as Vail Resorts lifts its recommendation to not come into the town unless it's, you know, necessary for you to be at work. And when they lift that, you know, we'll bring in our engineers and, you know, everyone in housekeeping to do a deep and thorough clean and do all the repair and maintenance that we would kind of normally do in May, but we'll do that a little bit sooner probably once this all passes over.
Jess?
Yeah, yep, and I agree with everything everybody's been saying. Also keep in mind that Ecolab has some really great EPA-approved products, and I would definitely look at the hard surface sanitizers and disinfectants. Those have been really great. There's some that you can leave on a little bit longer, so your cleanup process might take a few more minutes, but they do have some products that you can leave on for a minute or up to 10 minutes and then wipe it off. Be careful what you're using that on, but on your counters, you know, on your chairs, on the door handles, on things that, you know, you'll have a few minutes in between clients coming in that the therapist can wipe down. Those are some really great products. You know, again, I would, you know, make sure you read it before you use it so that you fully understand it. But some products like that can really help to kind of kill just about everything.
Okay. All right. I would also just make a recommendation. There's another product line called Zogix, Z-O-G-I-C-S, and they have a cleaning that kills MRSA, but it's a natural product and it has, I believe, silver in it. So you can go to their website and check it out. Next question is, let's see here. Just a question about, are spas interested in promoting products sales online with their websites or an affiliate program, and so they can offer self-care options at home? Are you guys doing some promos on your websites for product sales, and how could a vendor help promote that to your guests? I thought that was a good question. Anybody?
We currently do not offer anything online, so I can pass on that.
Okay. Anybody else?
Oh, while we have an online presence, it's again, it's we're closed at this point, so it's something we need to strategize about, and haven't quite gotten to. So it's a really good question. I do think that we'll select certain things that we know are very popular, and even potentially offer a pickup at the spa when that's appropriate.
Yeah,
Yes.
this is Jessica. I definitely agree. That's not something we're doing, but it's something that's a really good idea. And I was trying to find the article while we were talking, but I did just recently read an article that, how companies in China had to redevelop themselves as they shut down. And the ones that really kind of came out of it were the ones that were really innovative and thought of new ideas. And so they had their, a skincare line, and they didn't mention which one, but a skincare line in China had all of their field reps become influencers online, and that really helped to boost their sales. So when they came back, they were reaching out to other countries for, to trying to promote the line, and it really kind of kept them going through the downtime in China itself. So that was something they could do from home and really help push those sales. So that would be a recommendation that I would make to any of our skincare lines, or any partnerships that that aren't establishments, actual physical buildings. Start thinking about what else you can be doing, even smaller businesses, to influence people online, because we're all sitting at home. What are we doing? We're on our phones, right? So what else can we be doing to kind of get more people to be looking at what you're doing or your skincare lines?
Mm-hmm. Mm-hmm. So a couple questions have come through about the training piece. So what's the best way for vendors to reach you in terms of getting videos to you? And then would there be...
Oh, we lost you again.
Would there be ways for vendors to host sort of interactive webinars similar to what we're doing right here for your teams? Is that something you'd be open to?
Absolutely.
That's a little bit tricky, because we cover training, and if my staff is doing anything to get better, we should cover that. So that'd be something I have to run past the owner to ensure that he'd approve that type of expenditure. But I think the resources of a webinar are excellent, and would certainly appreciate that from any partners as an offering. Then we just need to look at what we had scheduled in terms of training and make sure it fits in there.
Mm-hmm.
Yeah, I agree.
Right. We have some questions about steam rooms. What do we think that steam rooms, do you think that they're the greatest possibility for contamination, or because of respiratory issues? I mean, how are you guys feeling about steam rooms going forward?
We have a steam room here, and it was one of the first things that I shut down, because those of you out there in the hotel world know that every sick guest comes down and is like, oh, I feel terrible, let me go in your steam room.
Mm-hmm.
Like, we hate to say that, but we know it's true. So yeah, that was one of the first things that we shut down, just the contagion in there. You cannot clean it enough. It cannot be contained enough. So unfortunately, yeah, that was one of the first things we eliminated.
Okay. And it sounds like it might be the last thing you bring back.
Yeah.
Oh, she's coming in now. All right, so why don't we move to just some general recommendations about what you guys think the impact will be from economic perspective, and how long this might, like, where are your check-in points? Are you checking in at a month, at 2 months? Like, how are you going to structure that in terms of thinking to the future?
So we haven't really settled on a date, but kind of May 1st is in our mind. So we're informing guests up until that point that we're likely to be closed, but we'll keep in touch with them. The other aspect is, what are we going to do to support the community during this time. This is an amazing place of respite, and we have healthcare workers in our county that are going to be pushed to the max. So Michael, our owner, is reaching out to health officials, and we're going to volunteer our gardens as a place of refuge for those workers, and ensure that they have a place to get away and de-stress for a while.
Great.
That's beautiful.
Yeah. Leya?
As the information, again, just changes constantly, like literally, I'm sure you are all faced with this. It is minute by minute, hour by hour. We're just getting new information. Our strategy plan has just been evolving, and our strategy plan today may not be what it is tomorrow, but we are actively working on one constantly. We have different contingency plans and the kind of what if, but just forward thinking and looking at the big picture and looking at all possibilities. And it's not about being panicked. It's not about being fear-based, but it's about making good decisions, you know, with strategy in mind and considering all the partners involved. I think that's the best thing we can do in something like this, accepting that it is happening and moving forward from there.
Jess?
Yeah, I agree with everything that Thor and Leya have been saying. You know, we have several contingency plans as well because you don't know, you know, this is such an unsure time for everyone. And I think, you know, it's, you know, we're not sure. We have our opening date set at May 1st, but that may get pushed back. I'm hoping it doesn't. You know, ideally I have a, you know, kind of like a recovery timeline set in place, and we're hoping that we get to stick with that, but that may not be the case. So, you know, I'm hoping to have my team back into the spa, you know, a week or two in advance so we can really start our summer training program before we open our doors so it doesn't, you know, impact our revenue.
We have someone coming from the floor to talk to us. Joanne, go ahead. Can't you hear us?
Hi, I don't know if I'm coming in as Joanne Berry.
You are.
Joanne invited me into this group because I work with, I'm part of the Global Wellness Institute. I'm the vice chair of the Mental Wellness Initiative of the Global Wellness Institute. I have worked with Joanne Berry, and that's why Joanne kindly invited me, and thank you, Joanne. I felt compelled to just say a couple of words because I've been hearing everybody and I think it's extraordinary. And I wanted just to preface my comment by saying that I'm an innate optimist, and I believe that everything that happens for a reason, and they're great lessons. I wanted to point out three important things to all of you because you're on the front lines and you're dealing with, you know, general population. I work with some leading epidemiologists and European public health figures all over the world. Joanne knows actually one of them. And I just want to caution a couple of things. All the evidence right now seems that, unfortunately, in this country, we're very ill prepared for this. That means that transmission is really completely invisible. That is to say, a lot of people who are super spreaders and transmitting this are keenly unaware that they are. And I want to specifically talk about the kind and really heartwarming offer for healthcare workers. One of the biggest issues, and that we're seeing in Italy, and I get information, data, pictures from the front lines every single day from northern Italy, is that healthcare workers, doctors and nurses are dying every single day in great numbers, and they're not just old, young people as well. And that is because this virus is insidious, and because part of what happens is that a lot of people, including healthcare workers, will be unaware that they are infected. In the United States, there are not enough tests, and if healthcare workers are not constantly tested, there will be no way of knowing whether or not they are in fact contagious. And the contaminant, the pathogen, seems to work very well in the first 5 days and in a completely silent way. Young people, it seems, and they're still working on it, are big spreaders, particularly children. Everybody has heard that, and that is because their immune systems and their lungs are pristine. So they seem to be able to carry it very well and transmit it, but they are not actually having any symptoms. So I just say this because going forward, and to take in healthcare workers, that obviously is an extraordinary thing. They really need it. These guys are going to be the heroes of this whole thing. And just be aware that if you take healthcare workers in, you have to ensure that they are in fact not contagious, because that actually could be counterproductive. So that's just on a very pragmatic level that you.
Yeah, Joanna, we're actually closed. So
Yeah.
And
Yeah.
we would definitely work with their agencies to make sure we keep Osmosis safe afterwards. But thank you. That's really great advice.
Yeah. Thank you very much. Let's see. We have a couple of other questions and time for a few more. So one of the other questions was, what are the best processes and procedures for cleaning like saunas and steam rooms? Like, do you guys, maybe Jess or Leia, you have some written procedures that we can share with the group?
I mean, I would think, you know, whether you work with the Eco Lab or whatever company you are working with to get your chemicals, I think you follow their guidelines. For us here, what we will be doing is also employing a company like Steam Master to come in and do a deep clean of our saunas. And then of course, following all disinfecting guidelines thereafter.
Okay.
Yeah, I agree. We shut ours down, just
Right.
like Leia did. That was like the first thing to go. I feel like, especially with the steam room, I agree that it doesn't matter how well you clean it.
Okay.
Yeah.
That sounds great. But I am wondering if people have like written things, or if there is like, how, when you reach out to somebody like Service Master, what precautions are they taking in terms of who they're bringing into your building to do the actual cleaning? Like, are they suited up? Are there things we should look for? It seems like there should be some protection for them and from them, right? Like the
Sure.
double, right? Any thoughts?
I mean, you would hope that companies whose job it is to do mitigation would have their safety procedures in place.
I just didn't know if you were vetting in any particular way.
Yeah, we're in a small community here with limited resources for that. The companies that we work with, like Steam Master, they're well reputed, and we'll be closed during that time anyways. The virus, as we know so far anyways, can live up 24 to 72 hours depending on the surface. So as long as we've gone after they've been in and disinfected all those surfaces, I think as far as I know, we should be okay. So yeah.
I do think we have one last question here, which is, does anyone here have memberships?
Yes.
Yes.
Yeah.
So one of the questions we're getting is, if you are a spa with a membership and you've closed, are you suspended payments or are you delaying payments? How are you handling that?
Well, we're going to communicate to our members first about the need to close, and give them the option to either suspend payments or continue to pay, and we'll extend the membership. So that will be communicated to them in this week.
I agree with Thor. This is Jessica. We're doing the same thing. They can either, not pay right now and continue their payments when we reopen, or they can add the time that's lost onto the end and continue the payments. I think if I were a smaller business, that would help me to say, we've missed 6 weeks. Once your membership is up, you'll get an additional 6 weeks at the end, and that way you're ensuring that payment's still coming in.
Okay. And what about gift cards? I'm hearing I'm hearing and seeing some programs where people are encouraged to purchase gift cards like 6 months out or as gifts. How are you guys handling that?
Yeah, gift cards never expire in the state of California, so they our trend this past week was actually we do a 4-year comparison, and it was even with the last 4 years in terms of volume. Certainly, not being open will curtail some of it, but we have online gift sales, and we had sales already today.
Okay, great.
That's great. Yeah, I agree with Thor. I mean, here in Colorado, gift cards never expire either. It's a great way, especially I think for smaller businesses to really get by. And it's a way, especially for smaller day spas, if you are going to close your doors and you do not have the financial resources to continue to pay your rent, et cetera, that you can enlist community support for you, especially if you have regular customers. I think that is a great point. So I'm glad you brought that up.
Jess?
Yeah, we're doing the same thing as we kind of move through this week, as this is the week that we close. Next week, our marketing team has a plan in place to start promoting gift cards because our gift cards also don't expire.
All right. I've also heard, and tell me if you guys are getting feedback about this, that folks who are regular patrons are actually sending in gratuities to people that they have seen. They're sending in gratuities to people they have seen on a regular basis as a way of saying thank you. Are you seeing this? Are you facilitating this? How can we encourage this?
I think it's a great idea. We've only been closed a day, so I haven't seen it, but knowing the loyal customers we have and the many requests that our therapists get, I can't imagine they wouldn't get something like that. So that's awesome. I think we need to think of a way to receive that for them.
I think that this would be an amazing. I think this would be an amazing thing to offer in the industry so that our individual businesses and operators can encourage repeat patrons to continue to tip their service providers, even as a way of keeping morale up and encouraging people.
Yep.
I absolutely agree. I think that is such a great idea. Our industry here, and Jessica's probably in the same boat, is we don't have a lot of local regular clientele. We're dealing with strictly tourism market. So perhaps we might see some of that for some of our homeowners here who are in our residence club, but it's hard to say. I mean, I hope for that. That would be great. But I do think for day spas out there across this nation and beyond, I think, just the gift cards and the gratuity, what a neat thing to do to support, service providers during this time. That would be amazing.
Mm-hmm. Mm-hmm. All right, I'm getting a few other last minute questions here. One of which is about the notion that the heat will kill the virus. What does our collective mind here think about that? And how are we responding to that?
Again, the decision was made for us kind of, and it's like 42 degrees here right now. So we can't quite count on the heat. And again, looking for that kind of magic bullet that will kill it. In the space we're in right now, I wish we had it, but we have to conduct our business in the way that what we know, and what we know is the best thing to do is be closed right now.
Okay.
Correct.
Yeah, I agree.
Agreed.
All right. Well, I hope everyone has found this incredibly helpful. It's really nice to chat with all of you and feel like we're all in the same boat together, and that rising tides lift all ships, and that we can share this time of community. We are going to do this every Tuesday, 3 p.m. Eastern Time, 12 p.m. Pacific Time. We'll have some new guests next week who can talk to you, and we can stay connected and talk about the ways in which we're coping. So thank you all for coming and sharing.
Thank you, Joanna, for getting that going.
All right.
Yes, thank you all so much.
We'll see you all next Tuesday.
Yes.
Thank
Bye.
you.
Thank you.